Okay, what's up, everyone? I'm Veronica. I am the founder of the Dunedin Wellness Collective, and I am here today with Dr. Maria Guzman, which I was so excited to meet Dr. Guzman because Dr. Guzman is not like your typical doctor. She is a triple board certified physician, and she specializes in sleep and metabolic health. But even though she's been trained at some of the top universities, she has a more holistic approach, a patient first approach. It's not the situation where you wait in the waiting room for an hour and then you see the doctor for 5 minutes and she writes you a prescription. This is the opposite of Dr. Guzman. So, welcome, Dr. Guzman. I'm so excited to talk to you.
Yeah, thank you so much for having me, Veronica, for
No
introducing me
problem. My
to
pleasure.
your community.
Um,
Yeah, go ahead.
yeah, just tell us a little bit about how you are different from a lot of the other doctors in your field.
Yeah, absolutely. So I'm what you call an integrative sleep specialist. And what does that mean? I'm building Dream Life Medicine and Wellness, and that name is very intentional because throughout my medical career, I got to the point where I had accomplished my dream life or what I thought it was going to be for 12 years of medical training. I was like, when I get that dream job, I'll be set, I'll be happy, and it'll all be butterflies and flowers and everything. And what I found out through my journey is I started having physical symptoms of the chronic stress that had driven me through my career. And the moment that I was at that finish line, that stress started to show up in headaches, in migraines, in brain fog. So I know what it's like to be a patient, and I know what it's like to feel like you're not heard in the office where you say, "Hey, I have this symptom," and the person that an optometrist where I was like, "Hey, I can't see. I lost part of my vision in my right eye." And I went to the optometrist and I said, "Out of those six letters on that board, I can't see the ones on the right side." And he said, "Just focus on the ones that you can see." So he kept doing the lenses and he said, "You have 20/20 vision, come back in 3 months." I'm like, "You missed the point. I can't see the right side of my vision." So I had to, find a physician that heard me. And through testing, I was diagnosed with optic neuritis, so inflammation of the optic nerve. And by all intents and purposes, I'm healthy, I'm young. Like, why is this happening, right? And through all of the work of figuring out what is going on with my nervous system, I am building a practice that allows me to take care of myself so I can show up better as a doctor, as a sister, as a daughter, as everything, and recognizing that the health is the most important thing. And I spent my whole career ignoring my health, learning to take care of others. And that was my awakening, was when my health spoke and it said, "Hey, you have your dream life, but you can't enjoy it if your health is not there." So that's what has been my inspiration to create a personalized practice where I take care of the whole person, mind, body, labs, everything that involves medicine, traditional medicine. So I use FDA approved medications, of course. As a sleep doctor, I help assess the root cause of daytime sleepiness, of non-refreshing sleep, all of the symptoms that can happen, especially for women around those midlife years where sleep just becomes impossible sometimes.
hmm Yeah, sleep. People don't realize how important sleep is in terms of physical healing. If you're not getting proper rest, then your body can't actually heal itself. Can you give us some examples of what a typical treatment plan might look like for somebody who comes to you with sleep issues, including all the holistic side of things as well?
Yeah, I do a very thorough medical intake if you're coming with a sleep concern. It might be difficulty falling asleep. It might be waking up multiple times throughout the day, or it might be somebody that says, "I'm sleeping 8 hours and I feel not good during the day. I can't concentrate. I feel sleepy, fatigued all the time." I help people identify the difference between fatigue, daytime sleepiness, and tiredness. Tired being that kind of exhaustion that you sleep one night and you feel better the next day. Like you went to Disney World and you're tired, you
hmm
get some rest, you feel better. Fatigue sometimes is that like emotional, cognitive load fatigue that just doesn't get better with rest sometimes. And then there's the sleepiness, which could be a function of abnormal sleep physiology. Could it be a sleep disorder like insomnia? Is it sleep apnea? Women in perimenopause have 3 times the likelihood of developing sleep apnea. because of hormonal changes, because of a drop in estrogen and progesterone. So we check all the symptoms that we want to guide what we do next. I offer home sleep testing in my practice.
Mhm.
And the type of sleep testing that I use is very easy. It's a ring that you put on your thumb or on the tip of your fingertip. And what's amazing about that is it tells me a little bit about the state of the nervous system. I
Mhm.
see sleep as a function of the nervous system. It is. Our brain waves have to be in a slow pattern in order to get that deep restorative sleep.
Mhm.
And sleep isn't something we can force. It's something we have to allow our body to go into. So it's not like any other behavior where it's like, just go for a walk. Well, you can do that, or make a healthy meal. Okay, I can do that. But
Mhm.
if I tell you sleep right now, Veronica, close your eyes and sleep, you're not
I
going
wish
to
I
be
could
able
sleep
to, right?
on command. My
It's
whole
not
life would be different.
voluntary. Yeah. And so the problem that comes up with insomnia or 3 or 4 a.m. awakenings is
Hmm.
that it's really hard to go back to sleep. And the natural thing to do for us perfectionists and overthinkers is like, I just need to sleep. Like, I'm going to have a terrible day if I don't.
Hmm.
What's wrong with me, right? Why am I waking up? And so I help people work with those thoughts and use the first line treatment for that kind of pattern if it's insomnia, which is cognitive behavioral therapy for insomnia.
Okay. So there's a component of mental and emotional health, right? That's involved with sleep. Can you
Yeah,
talk a little bit more about that?
absolutely. If we don't sleep, I mean, how many of you listening, right? If you don't have a good night's sleep the next day, you feel more cranky, you're irritable, you're reacting at everything that happens from the traffic to like spilling your coffee. If you've slept well, you can
Mhm.
be like, oh, I spilled some coffee, but like, oh my God, if I don't sleep well, it's the worst thing in the world, right? So everything that we do emotionally is processed in sleep, which is why we dream, right? We dream about things that are scary. We dream about things that we're excited about. So it's not a coincidence that the word dream has two meanings. It means an ambition, a goal, something you want to get to, but it's also a image that comes up during sleep, which sometimes we remember, sometimes we don't. So rapid eye movement sleep, REM sleep, is when we process a lot of our emotions, and if we're not getting good quality sleep, it impacts our physical, like our emotional health. In perimenopause, we may have more anxiety and depression just because of the hormonal changes by themselves, but we add on to that hot flashes and the impact on muscle tension in the airway, that these muscles kind of get tight. I mean, floppy as we get older into perimenopause. And so there's more likelihood of sleep apnea and disordered breathing issues that can cause sleep disruption. So we look at all of that because you may think about it like, who talks about sleep doctors, right? Sleep is like take magnesium, take melatonin, like go to bed early, use blackout curtains, don't drink caffeine. All of these sleep hygiene techniques are important. It kind of sets the stage.
Mhm.
But sometimes that's not enough. When we have an actual sleep disorder, when we are worried about how we're going to sleep tonight, when we are overly obsessive about the data on our Oura Ring or Apple Watch, those are all signs of, okay, we're stressing about sleep. And that in itself prevents your brain from going into those slow waves because it's in a state of arousal. So hyperarousal is that action of the nervous system
Mhm.
that prevents deep restorative sleep. So that's the approach that I take.
You
I've
mentioned,
been someone that has a dysregulated nervous system, and
so
I'm
you
a
know what
sleep
it's like.
doctor.
Yes.
Yeah, it's like the worst imposter syndrome I could experience.
Yeah, there's a saying that I heard once, people don't know how much you care until they care. Wait, what is it? Do you know what I'm talking about? People don't care how much you know until they know how much you care.
Mm.
So it's just so important, even though you have all this knowledge, to come from just a really heart-centered place of caring about your patients. So
Oh
that's
yeah.
awesome.
Yeah.
Um, you mentioned cognitive behavioral therapy. Can you tell us about that and how does that help? How does
Yeah,
that?
you may have heard of cognitive behavioral therapy, like for anxiety or depression, which is working around the thoughts and the feelings and the behavior that happens in the human experience, right? Sometimes
Mhm.
we have anxious thoughts or overthinking thoughts, and that impacts our experience of our day. And so there's a very specific way of using and addressing unhelpful thoughts about sleep in a prescription way of cognitive behavioral therapy, specifically for insomnia. It's called CBTI. So it's not like just analyzing emotions and that kind of thing. It's looking at very specific stimulus control techniques. And what that means is reassociating the bed with sleep. Because when we have insomnia, the bed itself becomes like a stressor. Like
Oh.
I'm already dreading going to sleep because I know I'm not going to sleep well and I know tomorrow's going to be terrible. So this loop of thoughts that comes up when we have been in that state where sleep just doesn't come,
Mhm.
it can create this conditioning where now the bed itself becomes the thing that keeps me awake. And so we use certain techniques, like for example, you may have heard this before, like don't stay awake in bed if you haven't fallen asleep within 20 minutes. Get out of bed, only go to bed when you're sleepy. Wake up at the same time every day. Those are some of the rules around CBTI, but beyond that, we dig more into the thought patterns that come up.
That's amazing. I love that you have that holistic approach. It's important. So you have mentioned to me about you have some projects, some community projects. I know that you're passionate about as part of physical health, creating community, right? Can you tell us a
Yep.
little bit about your projects that you have coming up and what you're doing with that?
Yeah, so I practice something called lifestyle medicine. What that means is our day-to-day behaviors and the things we do and the people we surround ourselves with can impact our health significantly. So that's the things we eat, our physical movement, our stress, of course, our social connections. And so community is medicine. When we show up and we get seen and we can share the humanity and the whatever difficulties are coming up, we can externalize that rather than internalizing when we're sitting there with social media, beating ourselves up because other people are doing amazing things and we're over here not feeling good enough or not feeling like we're doing that we need to be doing more. And
Mhm.
so when we show up in community and we recognize that like we're all human and we have a heart-centered nature, right? Like I'm doing a business in a different way, but it's because I care. It's because I want to do things differently.
Mhm.
Um, then that is powerful. So I have two things that I do that are free. Walk with a Duck is a nonprofit organization that I volunteer with, and I lead the walks in Crescent Lake Park the second Saturday of each month at 9 a.m. We meet by the dog park. We talk about a health topic, and then we do a couple loops around the park. And I have an online circle community where I'm building it. I'm trying to post motivational content, accountability content for anyone who's on a health journey, especially if you're focusing on improving your sleep health. I do free workshops each month to talk about the physiology of sleep, helping you understand from a science perspective what makes or breaks your night
Mhm.
and working with mind-body tools, nervous system regulation tools like breath work, guided imagery, visualization. It could be a somatic practice like tapping or shaking and dancing, whatever the room is feeling,
Mhm.
and understanding that we have control over some aspect of our nervous system if we work on it, especially in a group.
I love that. You're out there making changes, creating ripple effects with the world. So that's amazing. And now, if people want to book a session with you or an appointment, how do they find you? Where would they contact you?
Yeah, on my website, dreamlifemedical.com, you can
Okay.
book an appointment. You can also find a link at the top that says free sleep workshop and free walk with the doc, walk with Dr. G, whatever it says on there. So that's where you can connect with me totally free, no obligation. But as a visit, if you want to schedule a medical appointment, then there's the scheduling link on there as well.
Okay. And you have something coming up on the this week on the 21st,
The 20th.
the
So
20th.
Wednesday, May 20th is our next sleep workshop, mind body workshop for optimal sleep health.
Okay.
So that's open to anybody that wants to join, and I'll send you the link so you can share with the
Okay.
community.
Awesome. I'll be there.
Or I'll post it in the group actually. So I know
Yeah.
I'm in the group. I
Yes.
need to drop my introduction in there and some links.
Okay. Amazing. Well, I can't wait to see you on the 20th. I'll be there. And y'all come and see Dr. Guzman on the 20th and learn some stuff that's going to help you with your sleep and your health. So amazing. Thank you so much for speaking with us today.
Thank you, Veronica, for
All right.
having me. Appreciate it.
Have a great day. All right. Bye, everyone.